Thank you for joining us today. We will begin shortly. Thank you for joining. Please enjoy the event.
Welcome, everyone. I'm Elizabeth Dawes, Director of Maternal and Reproductive Health here at the Century Foundation. For accessibility purposes, I'm a brown-skinned Black woman against a white backdrop wearing a Black sweater. For those of you who aren't familiar with the Century Foundation, it's also known as TCF, and we are a progressive, nonpartisan think tank that conducts research, develops solutions, and drives policy change to make people's lives better. We also focus on education, economics, disability justice, and healthcare. During today's event, we'll discuss how abortion restrictions intersect with maternal health experiences and outcomes. But before we get started, we have a few housekeeping notes. Please note that this event is being recorded and live streamed. If you'd like to submit a question for our panelists, please do so using the chat feature. We're honored to be joined by Congresswoman Ayanna Pressley today. Thank you so much for being here, and thank you for your amazing work on reproductive justice, especially abortion access and maternal health. We'd love to hear your remarks whenever you're ready.
Thank you, Elizabeth. For accessibility purposes, before I begin, I'm a Black, bald woman wearing red lipstick and glasses. I think they're tortoise colored, with a white backdrop and a Black dress. Good afternoon, everyone. It is great to be in virtual community with you, with our fierce thought leaders and advocates for reproductive freedom. Freedom. That's what brings us all here today. Thank you to the Century Foundation and the Black Maternal Health Federal Policy Collective for your partnership today and every day, dating back to my very first term in Congress 6 years ago. I was proud to join my sisters in service as a founding member of the Congressional Black Maternal Health Caucus to affirm a simple truth. A safe and healthy pregnancy is a fundamental human right. That is what it should be. a right and not a privilege. I represent the Massachusetts 7th Congressional District. It is vibrant and dynamic and deeply inequitable across every issue, but especially health outcomes. Predominantly Black neighborhoods in my district, like Dorchester and Mattapan, lead in low birth weight, preterm birth, and infant mortality. And while Massachusetts has robustly invested in maternal health, being the healthcare mecca that it is, Black women are still more than twice as likely to experience severe maternal morbidity. But I remain committed to this work because lives depend on it. I remain committed to this work because, like many of you, the issue is deeply personal for me. Due to the lack of protection and concern for Black women, I never had the pleasure or the privilege of meeting my paternal grandmother. She passed away while giving birth to my father's youngest brother. And more than 50 years later, the Black maternal mortality crisis is still robbing us of our matriarchs, destabilizing families. That is why your partnership has been so critical. Together, we introduced the Black Maternal Health Momnibus and made progress. We passed legislation to extend Medicaid postpartum coverage. We held the first ever congressional hearing on the challenges of birthing while Black, and we were able to finally get much needed data to inform policy for lasting solutions. Just this month, in fact, the GAO, a nonpartisan auditing agency, published a report on my legislation, the Justice for Incarcerated Moms Act, which outlines recommendations for states to improve care for birthing people behind the wall. I'm encouraged and proud of the gains that we have made. But history, and certainly recent history, has shown us that gains are never guaranteed. Following the overturn of Roe by the extremist Supreme Court, the abortion care bans across this country have only worsened the maternal health crisis. Now, I've always maintained that the people closest to the pain should be the closest to the power, driving and informing the policymaking. When it comes to maternal morbidity, abortion care, and generations of attacks on our reproductive freedom, Black women certainly have been closest to the pain. So we should also be empowered. I'm devastated that families across this nation have borne the burden of Donald Trump's attempt at a nationwide abortion ban, which has resulted in a chilling effect of criminalizing those seeking abortion care, criminalizing providers, and criminalizing prescribers. Birthing people should be able to get the safe and necessary medical care they need in their communities. As I've been in states across this country, I've thought often of Candy Miller, of Amber Nicole Thurman, a 28-year-old mom from Georgia who died after being denied medical care. I spoke with her family, heard their pain, and know we must uplift her name, support her son, and do all that we can to prevent any more deaths. Amber's life mattered. Candy's life mattered. And those are only two of the names that we're even aware of. But too often, when Black women seek care, we are pushed into the cracks of a racist healthcare system that too often ignores our pain, ignores our voices, and discounts our value. Every single woman who has died because of Trump's abortion bans should be alive today. But what do we have instead? No compassion, no care, and no justice. Policies of forced birth, which is all a national ban on abortion is, a nation of forced birth. Policies of forced birth will only lead to more death. We're likely to see a 39% increase in maternal deaths for Black women if a federal abortion ban passes. That is why it is so critical to have spaces like this one, where we're centering the power, the lived experiences and expertise of Black mothers and working collectively to craft policies that finally advance healing, justice, and freedom. From combating the Black maternal morbidity crisis to finally enacting a national paid family leave program to tackling the affordable child care crisis and establishing universal pre-K. These are the policies that we need, not bans on our bodies. So I'll close with these three words that are powerful as much as they are necessary in solving the overlapping crises impacting our nation today. Trust Black women.
Thank you so much, Congresswoman Presley, for your remarks, for your compassion, for being a champion for us and highlighting the importance of these issues and what's at stake. I sincerely appreciate all the work that you've done, and I'm sure everyone on this call and listening and the other panelists appreciate it as well. So thank you so much. Unfortunately, Congresswoman Crockett was not able to join us, but we'll be sure to share her remarks at a later date via one of our media channels. And right now, I'd like to share a quick overview of the collective, the Black Maternal Health Federal Policy Collective, and our report. Next slide. All right, so the Black Maternal Health Federal Policy Collective is an interdisciplinary collective of subject matter experts ranging from physicians to advocates to lawyers to birth workers, people who have a stake in ensuring that we have better maternal health policies at the federal level and ultimately better maternal health care experiences and outcomes. We are working together to ensure that birth justice and reproductive justice are realized. Next slide. So we have a very critical mission, which is to lead the strategic advancement of Black maternal health through federal policy from inception to implementation. And we do that in a variety of ways. I encourage you to visit the TCF website, tcf.org, where you can learn more about the collective and our work, and you can also apply to become a member. Next slide. I just want to highlight a few key things from the report. It's a very in-depth report, very comprehensive, so it might take you a few minutes to get through it, but here are some key takeaways. Abortion care, both procedural and medication abortion, are common, safe, and essential health care. The emotional and physical health and well-being of Black women and birthing people are especially at risk when they are denied abortion care. We already know about the existing inequities and disparities, but those are heightened when restrictions come into play. Attacks on abortion access are rooted in the fallacy of white supremacy and in centuries of systemic oppression designed to control Black people's reproduction. As a congresswoman said, there's at stake becoming a nation of forced birth. It's not acceptable. Forced birth, forced reproduction, or any other action that takes away bodily autonomy is absolutely unacceptable. We also know that abortion restrictions have an effect not only on individual and community level health, but on economic well-being as well, at the individual level and at the population level. Restrictions on abortion also harm access to other types of reproductive health care, and you'll get into that in more detail in the report. We also leave with a few policy recommendations and an important note that the courts are important to pay attention to because of their role in setting policy and standards. So we need to ensure that we're paying attention at all levels and not forget about the court, not forget about the federal policy, state policy, and local policies and procedures that are affecting care. Next slide. So now we'll move on to hearing from our panelists. Dr. Parrott, I want to start with you. We're going to dive right in. And please, for accessibility, make sure to describe yourself, And I would love for you to start with the question, why is abortion access so important? And how do you see it connecting to maternal health in your work?
Thank you so much, Elizabeth, for that question, and to TCF for the invitation to join today. As was mentioned, my name is Dr. Jamila Parrott. I use she, her pronouns. I am a Black woman wearing glasses. My hair is in twists, and I have on a beige sweater, and also, similar to Representative Presley, red lipstick. So I am the president and CEO of Physicians for Reproductive Health. We are a network of doctors around the country working to advance access to comprehensive reproductive health care in the communities that we serve. When we think about the importance of abortion access, I think it's really critical to, one, acknowledge the commonality of abortion. We know that 1 in 4 people who identify as women have a need for abortion in their lifetime, have an abortion in their lifetime. Many, many more have a need for abortion. We also know that policies that restrict access to abortion care are often not simply limited to abortion care. We see the same states that have restrictions on abortion also have restrictions on access to contraception, also have restrictions on access to advanced reproductive technologies like IVF, for example, also have restrictions on access to care for young people, for gender expansive folks. So abortion, although we talk about it as if it were a separate and isolated issue, it is deeply connected to every part of our lives, and it is deeply connected to the desire to do exactly as you said, Elizabeth, to restrict and to limit the bodily autonomy of folks whose fertility is not valued equitably. We see this play out across the board in theories and practices like stratified reproduction, where we see the fertility of white, wealthy women valued differently than we see those who come from identities that are marginalized. So BIPOC folks, young people, LGBTQ folks, those living in rural communities, people living on low incomes. The fertility of folks who have marginalized identities is often devalued. And we see that these are communities that bear the brunt of so many of these restrictions.
Thank you so much for that overview. It's everything you said. It's really important. Brittany, I want to come to you now as someone who has lived experience accessing reproductive health care, abortion care. Can you tell us why and how abortion care, pregnancy, and parenting intersect for you?
Absolutely. Hi, everyone. My name is Brittany Mostiller. Pronouns are she, her. I am wearing I guess, sage green top. I have some light brown braids. I am a dark-skinned Black woman, and behind me are a couple of plants, and maybe my children's medals from some award thing at their school. Happy to be here. So as you mentioned, Elizabeth, yes, I have been impacted by so many of the things we're talking about today. I have had abortions with an S, and I want to make that very clear. But I became pregnant maybe 17-ish years ago. And it was within the same year of giving birth to my third child. And I immediately knew the best option for me and my family was to terminate that pregnancy. While deciding to have an abortion and making that choice was extremely easy, accessing the care that I wanted was far more complex. First, I made the assumption that my health care, which was Illinois Medicaid at the time, would cover my procedure. It did not. I was unaware of the federal policy that restricts federal funding for abortion coverage, AKA the Hyde Amendment. I was not making a living wage at my part-time job. And I had 3 young children under the age of 5, and I simply couldn't afford the mental, physical, or financial costs of carrying that pregnancy to term. So it's very clear that I needed to have an abortion. The financial support I received from my local abortion fund, Chicago Abortion Fund, was the only reason that I was able to access the care that I needed. So again, it was simple to make that choice. Folks often talk about, well, abortion is legal and it's that simple. That is absolutely not true. It also needs to be accessible. Um, Abortion care really allowed me to continue parenting, to continue loving, to continue learning with and supporting my beautiful babies. Through that experience of having an abortion, and the support of the Chicago Abortion Fund, I was able to learn about this term reproductive justice, right? Someone's ability to decide if, when, and how they parent in safe and healthy environments. And I also was able to deepen my own awareness and analysis of the many different repro health disparities that people face, particularly folks who have been pushed to the margins, more specifically Black women, Black femmes, and birthing people. Whether that's in my family, in my lineage, also my community. Like, I've really had a different understanding and experience of what folks needed to navigate, and why, unfortunately, my experience that I've just shared with y'all was not unique at all. My experience is far too common for folks who look like me. And so I would later go on to work at the Chicago Abortion Fund as their executive director, where I then was able to support hundreds of other Black women and birthing people access to care that they also needed and deserved.
This is Jamila, Dr. Parrott, if I could jump in. I love so much about, like, everything about your story, Brittany, in particular, really lifting up and highlighting things like the impact of federal legislation on your ability to make an autonomous decision. I think for so many of us, given that the Hyde Amendment was passed just 2 years after Roe was decided, I think folks forget that get one, that it's not the law of the land, right? That it is a rider that is intentionally attached to the appropriations bill year after year after year. And two, it has devastating impacts on folks. As an abortion provider, I am deeply grateful for the abortion funds and the work that the National Network of Abortion Funds does nationally, and the local abortion funds, and understanding the way that it allows people access to this service that is truly a human right, and is denied to so many people. The other thing that I love about your story, Brittany, is the fact that you are not so similar to every person that I care for and all of us. The decisions about contraception, abortion, pregnancy, parenting are not made in a vacuum. Right? Most people who have abortions already have children. They know what it means to parent, and so can really really holds space for this understanding that folks live complicated lives and should have access to the resources that they need to make decisions that they know are best for them. You clearly said, I knew that this is what was best for me and my family. And the federal government and your state government should have provided enabling conditions to make sure that you had what you needed.
Dr. Parrott, that reminds me of the Congresswoman's final remark, trust Black women. We're experts on our own bodies, on our own needs, and we just need the support in realizing those choices that we want to make for ourselves. And I also want to quickly remind people that who are watching, you can drop a question in the chat for us to get to towards the end of this conversation. We did receive some of your questions at registration, so we'll get to those as well. But please do, as you're hearing the conversation and listening and things come up, please do feel free to drop those in the chat. Dr. Parrott, I have another question for you as a provider. How have abortion bans and restrictions affected the kind of support that healthcare providers are able to offer people who are seeking abortion care?
So I'd love to say that, this is such a timely conversation, and I want to be very clear and naming the fact that the challenges that folks are experiencing accessing abortion in this moment did not begin with the Dobbs decision and the fall of Roe. And I think Brittany's story is a perfect example of that, right? We know that even prior to the Dobbs decision, when Roe was federal, when the right to abortion was federally protected by the Roe decision, folks still could not have access, could not obtain access, even though it was legal in their state, in their community, in this country. And so when I think about the premise of that question, how have bans and restrictions impacted the care that we provide, as someone who has been an abortion provider for well over a decade, what I see is that these barriers are growing, they're increasing, and they're worsening the conditions of our communities. They're making it sometimes insurmountably difficult for folks to be able to actually get the care that they need, whether or not you can reach the clinic in your community, whether or not you even have an abortion provider in your community, whether or not you have access to telehealth services so that you can obtain these if you're doing medication abortion, for example, to be able to get that in your own community. We see that these bans are very tricky in the way that they are insidiously trying to roll back rights. So, by way of example, let's think back to the COVID pandemic, and we saw during the COVID pandemic this really explosion, this outgrowth in telehealth services. Parallel to that, we also saw many states that were intentionally carving abortion out of those services, saying that yes, you can provide telehealth services for all kinds of care, but not abortion care, right? That too is a restriction. That too is essentially a ban. We see bans related to gestational age, someone deciding arbitrarily how late is too late for you to get an abortion. Is it 6 weeks? Is it 12 weeks? Is it 20 weeks? Is it 24 weeks? Without consideration to the life circumstances of that individual who is actually best qualified to decide when they need this care in the first place. We see bans and restrictions tied to provider scope of practice. So rules that say only physicians can provide abortion care, for example. We know that our advanced practice clinician colleagues provide amazing abortion care. They have similar, if not better, rates than we see for physician providers, certainly in maternity care and equivalent in abortion care. But we still have legislators that are saying this care has to be provided in this setting by this person under these circumstances. That means that folks have to travel further than they ever have. It means that they have to find and raise more money than they've ever had to. It means time off work, childcare. It means all kinds of logistical barriers. It is making it nearly impossible. Thanks to the Turnaway study, we have robust data that tells us what happens when people who are seeking abortion care are denied that care. We know that it has long-term economic impacts, social emotional impacts, impacts on educational attainment, economic attainment. We know that for folks who are seeking abortion care and are denied it, they're more likely to remain in or be thrust into poverty, to be tied to an abusive partner, right? When we talk with folks about the reasons that they need abortion care, it is for so many of the things that Brittany said. Primary, the number one reason is to care for the children I already have in the way that they deserve. So abortion bans have devastating effects on people's ability to get care. And it also has devastating effects on our ability as healthcare providers to care for our communities. It means we're spending an inordinate amount of time on the phone arranging transportation for people to get in. It means that when folks are coming in to get care, we're babysitting. Our staff is holding their babies, right? They're caring for the children that folks already have because they could not find care. It means we're finding hotels, we're arranging flights, travel from the airport because people are coming in and out. And to Brittany's point, also trying to raise the money to do it all on what is frequently a shoestring budget. And then the last thing that I'll say about these bans and restrictions is the impact that they have on criminalization. What it has done is pit patients against providers. And we saw this play out in the deaths of both Candy and Amber in particular, for folks who are afraid to seek care. in their own communities out of fear of being criminalized, of being arrested, of being jailed for doing what they know is best for themselves. It means that we have folks that are showing up into healthcare centers, and doctors, nurses, social workers, healthcare providers are calling the police on their patients because they suspect them of inducing their own abortion. I want to be very clear, there is literally only one state in which it is illegal to self-manage your abortion. But there are countless other states where people have been criminalized for the suspicion of doing so. And we know that because the criminal legal system in this country is the criminality is discretionary, right? It is also discriminatory. And so the folks that are more likely to be caught in the snare of criminalization are going to be folks that are already marginalized and disenfranchised. A recent report from Pregnancy Justice showed that in the year following the Dobbs decision, more than 200 people were criminalized for their pregnancy outcomes. Most of those people, if not all of them, were people who were living on low incomes. This is not a coincidence when we think about the impact that these bans have on folks.
Thank you for that response. There's so much to think about and to unpack there. And I really do encourage people to check out the report because we touch on quite a few of those things, how providers are not even learning how to provide abortion care at this point, how they're leaving certain states where there are restrictions. So this is going to have long-term, far-reaching consequences. But something you brought up, telehealth, also came up in the questions that we got beforehand. So you mentioned how abortion care was excluded from telehealth activities during COVID. But is there a case where you've seen that it has been used to expand access to abortion?
Certainly, we're seeing in a number of states the use of telehealth to broaden access to care. The example that comes to mind immediately is what's playing out in so-called shield law states. So these are states where abortion is not banned and providers are protected in providing abortion care via telehealth services around the country, even in banned states. Now, this is a tricky kind of setup because the provider is protected in the state for practicing medicine because of the legislation that's passed in that state, but the person receiving the medication is still at risk, right? They're at risk of criminalization. So it's a really a tricky thing to navigate. But what we've seen is those states that do not have carve-outs, that do not have bans around access to abortion, are working diligently to expand this access. So Massachusetts is an example, California is an example, New York is an example, but those are only a handful of places. And really what we need is a more expansive vision for what access to care looks like. And the other thing that I think it's important to really name is that telehealth services is not and cannot be for every person, right? We still need access to brick and mortar, to physical clinics. There's some people who are unable or unwilling, right, or just simply do not want to have their abortion that way, and they want to see a provider. But for other folks, not traveling, not having to go into a clinic, which almost always means walking through crowds of protesters who are screaming at you, right? For some folks, telehealth and virtual medical care is an appropriate and an acceptable option. And so for us, what we really want to keep in mind, and the thing that I think it's most important to understand here, is that there is no one solution to expanding abortion access. Telehealth services expansion will not fix it, right? Building a brick and mortar clinic in every city and every community will not fix access to abortion, right? It's going to take really a combination of approaches that include all of these modalities, but most importantly, that center the person who need the abortion first and foremost. So it is not up to me or to you to dictate how this individual should want to receive their care, but instead it is up to you and I to create systems that facilitate that care in the way that they desire it.
Thank you so much. Something else you said leads me to a question for Brittany, which is about decisions not being made in a vacuum, right? Context absolutely matters for reproductive health and family decisions. Brittany, can you share a little bit more about how you're seeing, or that you would expect to see, long-term health and life decisions be affected by abortion restrictions and restrictions on reproductive health care overall?
Hey y'all, it's Brittany again. I appreciate this question, and it definitely just continues so much of what Dr. Perry has already shared. So we know that like needing an abortion, that's an immediate thing, right? Um, Barriers impact, they extend far beyond like the immediate moment, and they impact so many different parts of our lives. And they really impede on our ability to shape the families that we want to create on our own terms, right? So things that folks often need to consider is like, will my provider, my practitioner, hell, even elected officials, right? The folks who are right here in my community, even the administrators at the local school district, like, do they have the analysis and the historical context for what is needed for Black women and birthing people to create and support their families on their own terms? And quite frankly, the answer is no for so many of us. We have to consider so much, like where we live, if we're purchasing a home, or if our credit score is where it needs to be to live in this certain district. It's something as simple as like, will I even be able to pay all my student loans or pay into whatever bills and debt? And if you can't, how that pushes you further into poverty and just disrupts so much of what you're already trying to navigate. It also, makes us consider like, well, where can I go for care? Like, where can I send my child to school? How does these school closures in this district impact my ability to like think about even becoming a parent? Like, do I want my children in a school in this school system that's like underfunded, severely underfunded here on the south side of Chicago, right? So these are like all, it's like a trickle down, up, out effect. Like it just expands far beyond what that person is deciding and moving through. We really have to consider a lot of that when we're making life decisions. Since working at the Chicago Abortion Fund and being funded by them, I went on to have another baby who's soon to be 12. And so much of like what I'm experiencing now and moving through was made possible because of my abortion, to be very clear. But also so many Black women and birthing people won't get that experience. They won't get that choice. They won't gain that understanding and awareness of like how their decisions or the decisions that they are forced to make, right? They won't get that far. We really have to consider and sit within that moment. Like, will we be listened to? Will we be taken seriously? Will we be respected when we're trying to expand or start a family? And this is just like basic as like, will I even receive the care that I need, regardless if it's repro health care or not? Like, is this in my community? Do I have these things? Usually, no, depending on where you're at, right? Something that Dr. Parrott mentioned was like the logistical pieces, people needing to decide, I need an abortion. I may have to make the decision to go out of state. Is there childcare for me? Because most folks, like you mentioned, are parents, right? Do I have the funding for childcare? Who's gonna watch them? Maybe they come with me. That's a whole other thing to consider, in finances and just like navigating that in and of itself. And essentially, these questions will and their decisions will completely alter the trajectory of folks' lives far beyond that moment. And I just can't state that enough. Dr. Perry, you talked about like folk, and also Rep. Presley, I talked about what it means to be forced to carry a pregnancy to term that you do not want. And I want folks to really imagine that. And I'm speaking as someone who's was forced to do that. I often share my story about being funded through my local abortion fund, and also prior to that, I was forced to carry a pregnancy to term that I did not want to. And that deeply impacts folks, not just, financially. And I don't want to make it seem like that's something really small, because that is a huge thing, like how our ability to like pay for things and access different financial resources is a very real thing. Money definitely is the strategy that meets so many of our needs, and mentally and emotionally, the impacts they have on folks. And so, as was mentioned earlier, like absolutely, we will see more deaths. We will see more lives changed and for the worse if folks don't have access to the care that they deserve.
Dr. Perry, it looked like you wanted to jump in and say something. Is that the case?
Yeah, I think that that's such an important point, right? We don't think about what happens to folks after they are unable to get this care that they need. We talk about the economic impact, we talk about the social impact. We don't often talk about the emotional impact and what it means to not just carry this pregnancy to term, but to parent under circumstances that are less than ideal, are ones that aren't what you decided for yourself. And that can have a huge impact, a generational impact. And I think we do not often talk about that. So mostly I was just agreeing with what Brittany was saying and strongly co-signing over here on mute, because it really plays out so frequently for folks every day. And with the Dobbs decision and the attacks on access to reproductive health care writ large, it is continuing to get worse and worse for so many communities.
Thank you for that. And these last two comments actually touch on a question that we received around, what are the consequences on mental health with restricted access? I also want to throw in, we've been bringing up the various challenges that Black women face just navigating the world, period. And we know that there's underlying stress that goes into that. So could you all speak to compounded stress and how that is going to affect people when we're talking about all of these inequities, issues with access, and not being able to get the care and make the decisions that you want to?
I'll start. Oh, no, go for it, Brittany. Yeah.
I was just going to share how important it was for me and continues to be for me to just be in community, well, be in therapy, one, and and additional supports. Like it's really important to find your community and be in community with folks who understand it and get it and who have also like moved through that or are navigating that currently. I don't know who and where and what I would be without my community, without other Black women who've had abortions, without other abortion storytellers, without other folks who are committed to like our collective liberation. That is deeply important, as well as therapy. I think they're both equally important. And it has been a journey of mine for like, the past 15 years or so.
Absolutely. When I think about the long-term impact of chronic stress, the first thing that comes to mind is the phenomenon of weathering. And this is a term that a public health researcher, Arline Geronimus, really introduced so many folks to, in talking about this cumulative impact of stress on Black women in particular. I'll offer an opportunity for us to reflect a little bit on the changing way we talked about the COVID-19 pandemic when it began, and how in the beginning there was this understanding that everyone was at risk. And this is not unlike the way we talk about maternal morbidity and mortality. Everyone is at risk. But when you start to peel back the layers, you see that it has disproportionate impacts on some communities as opposed to others, right? COVID did. We saw that Black and brown folks, Indigenous folks, folks in rural areas, folks living on low incomes were more likely to be infected and to die from COVID-19. Similarly, we see that Black women and birthing people, Indigenous women and birthing people are also more likely to experience severe maternal morbidity and disproportionately high rates of maternal mortality. Um, it was really profound for me to see the way that these conversations about COVID played out and how they parallel Black maternal health in so many ways. And in particular, really this understanding that it is not something that is innate in my Blackness that puts me at risk for either COVID or death during pregnancy. Right? It is not the melanin in my skin that puts me at risk. And so many of the folks that Brittany was referring to, right? The community of people, Black women who have been doing this work and organizing, and at the risk of putting you on the spot, Elizabeth, the work that you did as a co-founder of the Black Mamas Matter Alliance was transformative in really shaping the conversation, really being clear about the fact that it is not race, but it is racism that disproportionately impacts us. So this weathering, the chronic stress of experiencing racism day in and day out, the intergenerational genetic effects, right? The impact that it actually has on our DNA that is then passed down to our offspring that then impacts the way that we experience the world. And of course, the impact of our racialized experiences within the healthcare system that shape the way that we receive care and the way that we perceive care when we are looking for it, right? And so all of those things together really help us understand how we got here, why we are seeing these disproportionate rates in Black and Indigenous women and birthing people, why we are seeing less support, less resources. These things combine to create a perfect storm of mortality and severe morbidity in our communities.
Yes, thank you. Thank you both so much. We know that the situation is dire. We've heard stories, we're going to continue to hear stories, but I want to point out that there is hope, that we're doing this work to create change, that I'm not going to stop and we're not going to stop pushing until people have access to the resources that they need, that they have their full rights, and that they receive justice. So there's an upcoming event, an election, and people often rally around that, but there are things that we can do beyond politics that will make a difference. So, for people that are individuals in community that have someone that love someone who's had an abortion, whether it be activists and advocates, and policymakers, what can we do beyond going to the polls or beyond listening to these important webinars? What's the action that is available to us to make a difference?
Okay, this is Brittany again, y'all. I really, really love this question. It's always my favorite. There are a bunch of things you can do. I'm going to name 2 / a couple more. I encourage folks to donate to their local abortion fund, please. You can find yours on this interactive map at abortionfunds.org. If you have a few dollars to spare, it's a really old lift for folks who have resources. Please do so. They are the ones on the ground when folks who need abortion care are running into these barriers. They're the ones on the ground making it happen and making it a reality for them. And I have much love and respect for abortion funds. Second thing, which is like a bunch of other things, is just having understanding of our collective liberation and how abortion access is tied to that, and also getting clear, very clear on who we're accountable to. So what I mean by that is like having uncomfortable conversations with folks in your community. Like, I'm not advocating that you subject yourself to any type of harm. So please, do your due diligence and assess before going in, quite literally with those conversations. But I am saying that how we show up in everyday conversations with our people and our communities deeply matters. Like how we talk about abortion around young people matters. They listen, Native Future, they're going to repeat some of that. How we talk about these fake borders, these man-made borders matters, right? How we talk about or stay silent about multiple genocides or atrocities happening at the same time matters, right? So situating abortion care inside of our collective liberation is super important. So the big piece, talk to y'all people. Talk to y'all people. It's not every day that y'all are going to be watching us on a panel, or I'm going to be invited to a panel or lobbying somewhere in the state capitol. But I am at the grocery store almost every day. I'm at the coffee shop almost every day, right? I'm regularly posting and scrolling and doing all the things on social media because I love cat memes. And I'm elsewhere in my community. So those are the places where I continue to have these conversations and talk about what truly matters and getting clear on who my people are and how I build community and how I get free. So I just encourage y'all to keep talking. And if you're up against some folks who there's not harm involved, but there's some differences in values, I also want to lift up abortionfunds.org, which is the National Network of Abortion Funds website. There's a heart-to-heart conversation deck for folks to get cozy, get cozy and uncomfortable with these conversations that kind of help us identify what our shared values are around abortion access. And that's one way to just keep it going. I did this with my daughter and she was 5 or 6. We can have these conversations, y'all.
For sure, for sure. This is Dr. Parrott jumping in. I think one of the things that I would lift up is really thinking about, particularly in these conversations you're having with folks, and to your question, Elizabeth, about what folks should do. We are all operating along multiple axes of privilege. In addition to our oppression, right? Many of us experience gendered oppression, racialized oppression, economic oppression, but we also experience lots of privileges. So the question that really poses for me is, how do you use the privilege that you have to advance collective liberation for all people? Right. So in the organization that I lead, Physicians for Reproductive Health, we recognize that healthcare providers and physicians specifically hold a unique place of power and privilege in this country. And the question becomes, in my mind, what will you do with that privilege? What will you do with that power? Who will you fight for? It is a joy to be on this webinar, and I am often invited to speak in places that I know if I was just Jamila, I wouldn't get an invite to, right? But because I have all of these letters behind my name, I get a space in that room. But when you get the mic, what will you say? When you have an opportunity to fight, who will you fight for? And that is the part that is so critical. Our organization trains doctors to do this work, understanding that the medical profession is itself, it rests on centuries of genocide, oppression, white supremacy, enslavement. That is the root of the medical profession, right? That is the source from which we've grown. We also know that as people who are sitting often at the top here as in terms of what privilege looks like, it is our work to undo. Right? My expectation is not that patients learn how to better convince me that they deserve the care that they need in that moment, right? Which is often what I hear when folks say, advocate for yourself. You can't advocate for yourself in a system that is designed to oppress. That doesn't work, right? The power dynamic is specific, it's intentional, it is by design. So instead of me trying to empower somebody else to do something, my role as I see it is to disempower this system, so that people can actually live lives that are free. And I am not a barrier in my own position in doing that. The second thing that I would add, I love, 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 as I've said, abortion funds. They are meeting a critical need in this moment and have for a very long time. And there is no way we will get out of this by funding abortions one by one. That can't be the solution. People need care right now. And I am not saying don't donate to those funds. Donate to the funds. Support the abortion funds. Yes, absolutely. Do that. And we have to really have a serious and a significant conversation about a long-term strategy for change that includes systems transformation, or destruction of systems, depending on where you fall, right? And whether it's reform or revolution, we know that this is not serving us. And so while we are helping people to get what they need to survive these critical times, we also must be building a network of folks that are ready to undo the systems that have allowed us to be here.
Thank you so much for that. that reminds me of a conversation I had with a reporter about 2 weeks ago. And I was, as a public health professional, explaining the role of systems and structures, but then also explaining that systems are made of people.
That's right.
And that everyone at a certain point can make a decision that will help or harm. And so I'm hoping that piece comes out. I'm hoping that, she includes that quote, but that everyone will have a choice to make at some point. If a policy, if you're a policymaker and something comes across your desk, you have an opportunity to say yes to it, right? To say yes to the advocates that are advocating on behalf of their communities and the people that need direct services. A healthcare provider in a moment where they're interfacing with someone seeking care, they have an opportunity to say, yes, I hear you, I'm listening to you, I'm going to do something about it, right? In one of those cases that came up earlier, there was a point where a provider could have said, yes, we're still going to provide your care, even outside of these hours. Not that we should necessarily do that, but again, these are people making decisions based on their experiences, their realities. And again, like Brittany, you were saying, as a friend, a loved one, a family member, a parent, you can decide to have that conversation with your loved ones, with your friends over brunch, with your child, on the ride to school or wherever it might be. So I do encourage everyone to think about where they're showing up and how they can show up in service to better maternal health outcomes, increased access to abortion, and helping people live the best lives that they can. So we are almost at time. We've got about 5 minutes left. I do want to ask you both if you have anything that you want to share with folks that are watching or folks that will be watching the recording. Any final key takeaways on abortion access and maternal health care experiences and outcomes?
Sure, it's Dr. Parrott. I'll start. A couple of things. Like we spend a lot of time and energy talking about disparity and inequity, talking about death and the morbidity that so many of us experience. And what I would love to say is just to be very clear that there is still hope. There is an opportunity and an obligation to work towards building the kind of future we know that our communities deserve. And so, despite all of this, I am not hopeless. I can't be and continue to do this work. I think about folks like Elizabeth, like Brittany, and so many of our colleagues who are working day in and day out to create opportunities to make a way for folks. And that gives me deep hope. Is there a lot of work to do? Absolutely. Will I see the kind of collective liberation and reproductive freedom that I believe we deserve in my lifetime? Probably not. But it doesn't mean that it is not worth fighting for. And so if folks walk away with anything from this conversation, it is that the future is worth fighting for, and it is our work to do. We all have a part to play in this, and whether we are planting a seed for a tree we'll sit under, in 20 years or not, it doesn't matter. Our loved ones will. And so that is worth the effort.
Oh, this is Brittany again. I love that, Dr. Parrott. I'm over here about to cry. I guess I will just end by telling folks who've had abortions that I see you, I affirm you, and I love you, and invite you to consider like what was made more possible because of your abortion.
Thank you both so much. Thank you for your time today, and thank you for your time over these past years that you've committed yourself to this work and for the years to come. We know our fight's not over. There's, like you said, a lot of work to do. And I just encourage everyone who is fighting that fight to take care of themselves, to take good care, to rest when you need to, get therapy if you need to. I think everyone needs therapy, but that's a whole another webinar on mental health. Do those things that you love, spend time with your family, so we can come back to the fight replenished. It's a long one. As Dr. Parrott said, we're planting seeds, but it's possible, and I think that future generations will certainly appreciate the work that we're doing, and will appreciate those gains that we see in the next few years. So thank you to our panelists. Thank you to everyone who's been watching, who attended the event, and everyone who is watching the recording. And a special thank you to the Century Foundation for putting this together. And just so you all know, a recording will be made available immediately on tcf.org. Thank you, everyone, and have a pleasant rest of your afternoon.